Hello, I'm Dr. Collins, and in this short video we're going to go over a mnemonic I created that helps me remember the most common drugs or classes of drugs that worsen heart failure. This is a very useful list for prescribers to be aware of, not only to consider not starting a medication as it might exacerbate a patient's comorbidity of heart failure to begin with, but it can also be a useful tool for medication reviews as well when deprescribing is needed. Without further ado, here's our mnemonic: a fat cat naps. And the way I associate this mnemonic with heart failure is I think of an old man sinking into his chair, legs swollen and right at his feet. Yep, you guessed it right, a fat cat is napping. A for certain antifungals, especially the azole family of antifungals such as itraconazole or fluconazole, due to their negative inotropic effects, which means they can weaken the heart's ability to contract effectively. F for flecainide, an antiarrhythmic cardiology medication which can cause profound bradycardia. Second, A for antipsychotics. Both typical and atypical antipsychotics can cause this. The newer generation olanzapine, clozapine are associated with cardiomyopathies, and older generation ones such as haloperidol can cause QT prolongation. T for thiazolidinediones, which is a class of antidiabetic agents, and the only drug in this class is pioglitazone, which is known to cause fluid retention. C for calcium channel blockers, but not all calcium channel blockers. We're talking about specifically non-dihydropyridine calcium channel blockers, such as verapamil and diltiazem. And these specific calcium channel blockers can reduce cardiac contractility. Third, A for certain anti-cancer agents, including anthracyclines such as doxorubicin and anti-HER2 agents such as trastuzumab. T for tricyclic antidepressants such as amitriptyline, which can worsen arrhythmias and lower the cardiac output. N is for a very commonly used class of drugs, NSAIDs, the non-steroidal anti-inflammatories such as ibuprofen and naproxen, which promote sodium retention and therefore raise blood pressure and worsen heart failure. And the last, A for alcohol. It is very important, as with any other chronic disease, to discourage chronic use of alcohol as it can lead to alcoholic cardiomyopathy. P for prednisolone and other corticosteroids, which increases fluid retention. And finally, S for sotalol, another antiarrhythmic cardiology medication. There we are, a quick rundown of a fat cat naps mnemonic for drugs that can worsen or precipitate heart failure and therefore may be contraindicated or must be used in caution with patients who suffer from heart failure. I hope it will be handy in your clinical encounters. Thanks for watching. If you like this video, please hit like button and subscribe. And remember, we also have many other medical mnemonic videos and a free question bank in our website. Good luck!